Welcome back to the conversation, everyone. Marianne and I are so excited to have you here for Let's Talk Patient Blood Management. And we are stoked about our guest today, Dr. Vernon Louw. Marianne, why don't you introduce our guest?
Absolutely. Thank you, Professor Vernon Louw. Let's talk a little bit about Professor Louw. He is the chair and head of Clinical Hematology, Department of Medicine at the University of Cape Town and Groote Schuur Hospital in the beautiful South Africa. After his training in medicine and later internal medicine at the University of Stellenbosch, both summa cum laude, he trained in clinical hematology at the Katholieke Universiteit Leuven, Belgium. He then became head of clinical hematology and later the head of the Department of Internal Medicine at the University of the Free State in South Africa. He is the current president of the South African Society for Clinical Hematology and chair of the Global Transfusion Forum. He's also a member of the World Health Organization Working Group on Guidance for Patient Blood Management Implementation. Professor Louw's research focuses on the role of iron and education in patient blood management, and he has authored or co-authored more than 150 peer-reviewed papers and book chapters with more than 300 poster and oral presentations at the national and international meetings. On his YouTube channel, he has teaching videos ranging from iron deficiency to clinical reasoning, and we'll put a link to that YouTube channel in the description. Thank you so much. What an honor to have you here.
Great to be with you both. I look forward to this conversation. I was fortunate to be at the meeting, the SABA meeting last year in Nashville, and it was such a wonderful event, and so excited to be able to do this. We've aimed for this meeting a long time, so thank you for having me.
Yes, we have. You know, I almost got to meet you in person at that conference. You came off the stage and, you know, we go there for so much education, and you talked about iron deficiency in the developing brain, which is what we're hoping to talk to you a lot about today. And you taught us so many things that we didn't know. And so I just wanted to run up and, you know, invite you to our podcast, and everyone had the same idea. So you were rushed and there were so many people around you. And I thought I had pretty good odds at being able to have a conversation with you. I was number 3 in line, but people were just rushing in and shouting their questions. And finally you said, I apologize, I have to go. So
yeah, I had to catch a plane, right?
Yes.
Yeah.
But
Superstar.
I reached out online in virtual world and you gladly accepted. So thank you so much for being here today.
It's such a pleasure.
On one of your recent videos that you posted to your YouTube channel, the title of it was Iron Deficiency, Anemia, and Treatment. You said that this was one of the most important subjects in medicine and health in the world. And
Yes.
So please tell us, you know, what is the significance and importance of iron deficiency to the world and to our bodies?
Yeah, you know, they say the most important or most common problem apparently is dental problems. Now, I don't have much knowledge about that, and I don't like going to the dentist. I'm sure you do, but the second most common one is probably iron deficiency. And I think the reason why this is so important is that, unfortunately, doctors and maybe the public, I would imagine as well, really, really are not trained in the details of how iron affects our bodies. So when I was a medical student, all I learned was that iron deficiency causes anemia, and anemia caused all the symptoms of iron deficiency. They never explained exactly how it would make you forgetful or anxious or depressed or make your hair fall out. It was just assumed that it was all due to anemia. Now we know better, and I'm sure we're going to talk a lot about that today. But the reality is that if you look at the world population, about 1.5 billion to maybe 2 billion people are anemic. Half of all those patients have anemia from iron deficiency. But there's another, probably about 2 billion people who are iron deficient, not yet anemic, at risk of becoming anemic, but who have lots of other symptoms, quality of life issues, related to that iron deficiency that's got nothing to do with anemia. And that is really the area that interests me so much. And in particular, how that iron deficiency, if present in a pregnant mother, affects the development of the baby, but also affects the risks related to the pregnancy. Those are things that are so dear to my heart. And somehow, there was this one article published about iron deficiency in women, and the title was The Misogyny of Iron Deficiency. And I think it's very appropriate because women have been neglected in this area. And I think we as doctors should take ownership for the fact that we've not educated ourselves well enough. And for a long time, that was true of me too. But once you know, you can't unknow it.
Wow.
They do say these days, that one of the major forms of learning is actually unlearning, because we have to relearn the things that we've been taught wrong. And maybe this is appropriate here. We need to unlearn the bad things, the things that we've learned that are not correct, and learn what is new and then act on it. This is not, and I hope this podcast will not be just oh, that's interesting type of podcast. I hope this will be an actionable podcast where people will walk away and say, okay, I'm going to do this, this, this. I'm going to tell my daughter, my sister, my mother, my aunt, my uncle, these things because it can help them. And we all have a role to play.
I think you made a really interesting point there that a lot of medical providers were so good at identifying, diagnosing, treating anemia, but we don't really think deeper about what are the long-term effects and what else is it affecting. We just kind of see it, treat it, move on with our day. So yeah, I hope we could talk a lot about what are the long-term effects of ignoring anemia or, not treating it assertively enough.
I have asked on this podcast before doctors who have made the statement that iron deficiency to a developing fetus affects brain development. But when I ask them to dive a little deeper and tell me how that is happening or if it's permanent, they just say, we don't really know. We just know that it affects. So I'm going to ask you the same for a developing fetus and brain. What are the implications for an iron deficiency during pregnancy?
Thank you. So I think that's exactly the question we need to deal with. Is number one, like my wife always taught my children, irresponsibility is never neutral. Now, being iron deficient in pregnancy is not neutral. It's not just like I'm a strong mother, I can deal with it and I'll get through it and I'll be okay. No, it actually affects not only your risks, it affects your baby's risks. So coming back to what I said earlier, as doctors, we've been very focused, and I'm a hematologist. So hematologists, we work with blood diseases. The bone marrow is the factory of blood. So we're very interested in anemia and how red cells are made. But the truth is that only 50 to 60% of iron goes to the factory to make red cells. Now, where does the other 50% go? Nobody ever said, oh, it's sitting who knows where. No, it's sitting everywhere. It's working in every single cell of your body, of which the brain is critically important. And why is the brain so important in pregnancy? Because the fetal brain is much more dependent on oxygen in terms of oxygen requirements, but also in terms of iron requirements for a number of things. Many people who suffer from certain disorders like depression or anxiety, all these things might have been told by their psychiatrist or their doctor that it's all got to do with these chemicals in your brain. Now, these chemicals in your brain, we call them neurotransmitters. They are the things that are involved with the impulses that go through the nerves in the brain. So these neurotransmitters, serotonin, dopamine, etc., all of these things that make you feel good, that make your brain a healthy brain, the production of those neurotransmitters require iron. And there's a whole list and I'm not going to bore you with the actual names, but there's a whole list of enzymes, and enzymes are chemicals in cells that help activate certain reactions to make other things. And if these enzymes don't have all the necessary support factors, like of which iron is a critical one, they cannot do or make those other molecules that you require. And there are many of these enzymes that are iron dependent, right? Furthermore, what we now also have learned is that there are gene regulation networks that determine how the brain will develop, not only during pregnancy, but beyond pregnancy. So after the baby has already been born. And these gene networks, I mean, it's been known that they are involved with many things outside of pregnancy. But with pregnancy specifically, we're now seeing that if you are iron deficient at particular points during the pregnancy, for instance, if the mother is iron deficient in the periconceptual period, now she's not even pregnant yet, but at the time of conception or in the first trimester, there's a significantly increased chance that the child might be autistic after birth. If she is iron deficient in the second trimester and it's left untreated, I'm talking about, you're ignoring it. You're not taking it seriously.
Right.
There's a chance that the child might develop schizophrenia. Now, you might say in absolute terms, well, the chances are low, fine, but why should you take any chance if you can avoid it, right?
Yes.
Now, what's more is that during pregnancy, as time goes on, the iron needs of the baby's brain actually changes. So at different times of development, different parts of the brain develops at different rates. But in the third trimester, this is now when things become critical. That's now the time in the movie, when they start counting that clock down, 10, 9, 8, and the guy is trying to stop whoever from doing whatever. The third trimester is really critical because the brain develops most quickly in that phase. And if you don't have iron, and this is very iron dependent, if you don't have enough iron, certain parts of the brain is really going to suffer. And the one part that we've seen that's particularly important in that period is the hippocampus. The hippocampus is a part that's very much involved with memory and memory processing, and your ability to think about things and reason about things is very much linked to all of that. Now you'd say, okay, fine, that's all fine, but okay, let's say the baby is now born, and yes, the mother's now been iron deficient, but let's just treat the baby afterwards. The sad thing is, it seems like if the mother was iron deficient in that third trimester, and you don't deal with it there and then, the changes might be irreversible. And that is really bad.
Right.
So there are these critical periods. And the most critical period in pregnancy is the third trimester. You can still, let's say the mother was iron deficient in trimester 1 and 2, and you sort it out in trimester 3. You can reverse the risks of trimester 1 and 2. And you can even reverse the risks embedded in trimester 3 if you do it then. But if you wait till the baby is born, there might be issues long term. Again, I want to emphasize, it's not going to happen to all children. And you might have a genius for a child and you say, but I was iron deficient. Well, maybe that child could have had an IQ of 200. I don't know. The point is, not every child is going to have a bad effect. It's like some people will, some people won't, but it's avoidable.
Mm-hmm.
And then when you follow these children up that were born of mothers that were iron deficient, you see that over time, when you even if you give them iron after birth, you treat them with a syrup or whatever, you see that when they're 4 or 5 years old, they're behind their classmates where the mothers had normal iron. They're slower, they're a little bit more shy, afraid, closer to the mother. They're behaviorally not 100% there. Their language development is a bit slower. Their hearing have been shown to be affected, both in prematurely born babies and mature babies. And then you say, okay, 4 years old, it's going to be fine, just they'll grow out of it. No. When you go to age 7, you see that if you test their IQ, they're clearly behind. If you go to teenage years, not only do they struggle more with maths, language, also behavior, aggression, anxiety, depression, all the things we would just say, that's teenage stuff.
Mm-hmm.
You know, as if teenage stuff is not difficult enough to deal with. You don't want to add anything to it.
Yes.
But can't believe it, but when you follow these same children to adulthood, when they're 25 years old, it still affects them. It still affects their functioning, their mood, their emotional status, even their pursuit of goals, their pursuit of higher education has been shown to be different from the control group where this was not the case. Because you want to, when you get that idea, I want to have a baby, well, go check your iron. Start right there, from conception.
I feel as though the OB process, they do a good job of checking for iron deficiency early and telling mom to take a multivitamin that contains iron and folic acid, but they really don't educate to the importance of why they're telling her that. And so when I think back on my pregnancies, I took my multivitamin when I could stomach it. I didn't really I knew that they told me iron was important, but there was no real motivating factor behind, oh no, I've got to find the right solution and make sure that that I'm taking my iron supplement. So I think we're lacking a little bit in the education and
I think so.
awareness.
And I mean, there's a positive message in here as well. How much good can be done? How much trauma can be avoided? How much wonderful things can come from us as a healthcare system, you know, from a public health point of view, if we start looking after our pregnant mothers and babies well. Just take it seriously. Just take it
I feel like this is
seriously.
a huge problem in many countries, and it can greatly impact the health, the IQ of entire nations. Just treating iron deficiency, it's almost as simple as that.
You know, I think there's often been such a bias towards people from certain countries, and especially from certain poorer countries, thinking these people are this or that or dumb or anything. I've often wondered to what extent these, you know, racist slash ethnic biases are induced by people who just did not have the privilege of getting enough food.
Mm-hmm.
Because we've done research in Africa where we've seen, you will not believe how people in certain countries, one of my PhD students worked on iron deficiency, and I'm not going to mention the country now on air, but where in certain seasons, the women
Mm-hmm.
eat pods. It's all they have. They only have the pods from the trees to eat. There is nothing else.
Yeah.
Now, if you know, what chance does a child have that doesn't get the right nutrition in a setting like that?
Right.
And, you know, I think there's so much potential in the world that is unmined in poor countries, which we could all help with. And we could all, you know, through education, through whatever programs we have, food fortification, screening programs, where we can make a difference to help these kids and help these mothers as well. Because now the mother's been using so much of an iron in one pregnancy, but many of these families have many children, and it just gets worse as it goes along. Pregnancy 2, 3, 4, every time it's just worse. They fall behind further and further. And it's completely reversible, and it doesn't cost much.
When you're thinking of the challenges in underdeveloped countries and fixing the nutrition problem, where do you start? Where do you get the most bang for your buck?
What exactly gives us the best bang for our buck that has been scientifically proven, for which we've got lots of research, I think is food fortification. food fortification, both in children and in adults, I think in poorer socioeconomic environments makes a huge difference. And I think we should not underestimate that. It's something that can be done in a culturally appropriate way, depending on the local staples. Food fortification has been done with breads, with soups, with all sorts, with milk, all sorts of things, rice. So whatever the staple in the local country is, there's probably a way to
Fortify
to,
it.
to fortify that particular food. So there's great work done on that, and I think that is something that's not often mentioned because nobody can make money off of it, right? But anyways,
Right.
so that's not a cheap way, but it's probably a cost-effective way. So that's something we can do.
Yeah.
The other thing that I think is nice, traditionally in Africa where I am, people used to cook in iron pots.
Yes.
And iron pots, there was some worry, and there's a lot of research being done on African, what they used to call African siderosis or hemosiderosis, where people would develop the opposite. They would have too much iron in their bodies, which they ascribed to the iron pots. Now, I think it probably is not the whole story. I think there's some genetic issues related in certain individuals, because it's certainly not common. But what can be done is you can either use an iron pot if you live in an area where and many people in Africa still cook on fires, open fires with their iron pots, and that's great. It's because it actually helps. Or you can use something called an ingot, like a little iron thing, and they make these things in the shape of a fish or a leaf or whatever, and you put it into your pot, and it can last for a couple of years, can help the whole family. If you don't put too many of these fish in your pot, you don't actually taste anything funny. They have shown that if you put like 3 or 4 fishes in, then it doesn't taste good anymore. But if you just use one and you cook your stew or whatever with it, that gives a nice amount of iron that is dissolved and easy to take and not that difficult. There are also iron supplements that are not very expensive, but they're also not very well tolerated. That's a problem, but they are there and they're available even in Africa. They are generally affordable. The old ferrous sulfate, just nobody likes it because it gives you stomach pain and constipation and all the rest. But I guess the big hurdle to overcome is to actually screen for patients at risk and do it properly. So to get your patients who are pregnant tested to see how far are they behind, and when you give them treatment, to remember that supplement will probably only maintain whatever status they are in. So if they start their pregnancy iron deficient, it's unlikely to make a big difference. It's not going to treat them. It's just going to keep them there. And as the pregnancy goes along, their iron needs actually increase up to 3 to 6-fold. And that's where your problem comes in. So if you don't watch them, so first identify them maybe when they're pregnant in the beginning, and then follow them up semester 2, semester 3, trimester 2, 3. The way I talk, people will be pregnant for 18 months like elephants. It's not going to work. But anyways, so and I don't understand this. It's one of the biggest unbelievable things. People would ask thousands of dollars or tens of thousands of rands to look after a pregnant woman and to manage the birth and the cesarean section. But somehow for many, it's too expensive to test their iron, which is like $10 or in South Africa, for instance, And I must say, many of our obstetrician and gynecologists in South Africa have been absolutely fantastic. They've come on board, they're doing this, they're looking for the iron deficiency. And I think the message about the developing brain of the baby has been a big one. It's been a really big one for them. They realize, that it's one of those things. Once you know it, you can't unknow it.
Right.
And who wants to be the one who did not do something where they could have prevented something serious?
I have a question you may or may not know, but let's say that someone was born iron deficient baby. They have these cognitive deficiencies, ADHD. It's everywhere. Everyone has it.
Mm-hmm.
Um, and then they go on to have the second generation of children not iron deficient. Will that second child be affected by the parents' cognitive dysfunction? Or, is this a generational thing that you can't correct? Or by correcting the iron, can we correct future generations?
That's a very good question. I don't. It might be out there. I've not seen any research on iron deficiency specifically, but I've seen research in other areas like obesity, for instance, where exactly this
Mm-hmm.
happens. In that setting, there might be different things happening. There might be either changes to the gut microbiome that is transferred to the next generation, or they might be changing in what we call epigenetics.
Mm-hmm.
So you've got genetics, which is your DNA and the coding and so on. And then on top of that, you've got, which epi is on top of, you've got other systems that determine the degree to which certain genes will be decoded or not, which can be inherited to future generations, multiple generations down the line. And we know, at least from animal studies, that these gene networks are affected epigenetically
Mm-hmm.
with iron deficiency in the brain networks when patients are iron deficient. And that's one of the hypotheses how iron deficiency leads to schizophrenia, perhaps depression, ADHD, autism, and all that. And I don't think it is impossible or even unlikely that such changes could go to further generations, and that research will only be done in animals, not in humans, that
Mm-hmm.
such research have yet been done. Maybe it is, but I'm going to look this up afterwards because you've now asked a very interesting question.
This discussion it hits really close home to me, for me personally, because my mother, so she had a multiple of pretty quick pregnancies. She had an ectopic pregnancy. And then right after that, she got pregnant with my sister, 17 months older than me. And then quickly, I was unplanned. And so I was third pregnancy. And so I did fall behind. I had a lot of learning struggles in math and reading, and was slated as probably a little bit ADHD. And who knows, possibly my mother was iron deficiency from those, 3 pregnancies in rather quick succession, but impacted my life for sure.
Sure.
But I've been able to passionately explore my interests and move beyond it. But, I think of my children and, what's the impact of our future generations. So
Sure.
very interesting.
Very interesting. And thanks for sharing that, Sarah. That's, well, it's very clear that you've overcome whatever difficulties you had from the interactions
Right.
we've had. So that's
Yes.
amazing. And I think
Yep.
that's also true. We mustn't underestimate, the human's ability to overcome things and to
Mhm.
improve with the necessary support.
Yeah.
Of course, certain parts of the world, that support is not always there.
Yep.
And I think
Right.
people struggle a lot more to
Yes.
overcome these difficulties just because they don't have support, things that we might take for granted. People who have had the privilege of going to good schools where there might be extra tutoring or extra classes and personal attention.
Right.
It's not uncommon, even in South Africa, to go to a school where there would be 60 children in one class with one teacher and no extra help,
Right.
which is when these adversities strike, you just have very little, that you can do about it. I don't want to sound like this, a victim situation, but I think it's more difficult. I think it's much more difficult in these
absolutely.
environments. And so I'm grateful for you sharing that. And you've described perfectly the type of pregnancy where the child would be at greatest risk. Short
Yeah.
succession, short intervals. Then if the mother, it's unplanned, so she might not have tested beforehand and checked whether iron was adequate before conception. And
Right.
every pregnancy requires an additional 1,000 milligrams of iron.
Mm-hmm.
So one to the next, the chances of depleting without supplementation is very, very high.
Right.
Very fascinating discussion, indeed. If someone is struggling, let's say, with depression, anxiety, all of this that we go to the doctors for, and often they'll talk about our serotonin or our dopamine. Is it routine for those physicians to check iron?
Sadly not. But can I tell you a story?
Mm-hmm. Yes.
So I had this patient a few years ago. She was a 30-something-year-old lawyer, very active athlete, running all these marathons, cycling competitions, etc. And she was sent to me by her psychiatrist because the psychiatrist said this anxiety disorder
Mm-hmm.
that she had is not responding as it should. And she said, I think, I take my hat off for the psychiatrist. I think it might be related to an iron deficiency. So the patient got some iron infusions. They sent her to me for another opinion because this patient is not responding to her iron treatment. Now, first, they were not giving adequate doses of iron at the time, but I could still see there's a problem here. Even though the doses were not adequate, something else was wrong. This patient's hemoglobin was falling. And this is the other key point about iron deficiency. We need to look for an underlying cause. Now, in a young woman, adolescent, young woman, fertile years, it's almost always going to be heavy menstrual bleeding or a poor diet, something like that. She has been menstruating for quite an early age, and it's been more than 20 years, but I wasn't impressed with that it's really heavy menstrual bleeding. And this is the important thing here. You mustn't stop when you're a doctor and you ask about possible risk factors for iron deficiency. Don't stop with the first thing. The patient's not eating red meat. That's my diagnosis. No. Ask everything. So I delved a bit deeper and I said, listen, have you had a bleeding problem, nosebleeds? No, not really. Menstruation's fine. Any bleeding maybe when you go to the toilet? Now and again there's some red blood in the stool, but it's not that much. So, she's not taking it very seriously.
Mm-hmm.
I said, wait, okay, I don't like this. 32 years old, I sent her for gastroscopy and colonoscopy. Colon cancer. Colon cancer.
Yeah.
The good news was, and I say thank you to the psychiatrist who got her checked out in the first place. We caught this thing in time. And she had surgical removal, did not need any chemotherapy, was cured. As far as we can tell, the lymph nodes were clear. Yeah. So it's a story. It's a nice story because it ends well, but It does not always end well for everybody. I lost my father from colon cancer that was diagnosed too late. Mm-hmm. And this is such an important point. If a person is postmenopausal, and also in males, or if you've got any rectal bleeding or changes in your stool pattern, the way, if you're always very regular and now suddenly you're constipated and then you've got diarrhea and it's stuck all over the place and you just know something is not right. Those patients need to be investigated. And when a doctor writes his notes and he gets the lab result and he says, this patient is iron deficient, I want him to say there, what is the cause? So did you ask the patient specific questions about how heavy their menstruation is? It's not like, how heavy is your menstruation? No, doctor, it's normal. what is normal? Nobody knows what's normal.
Right.
Because the patient's mother and sister, they're all the same, but who knows? Maybe they all have a problem.
Mm-hmm.
Now they all think it's normal. And this is not, I'm not joking. This is something I see every single day. They tell me it's normal. Now I ask the key questions. Okay, do you bleed through at night? Do you bleed, do you have to use double protection when you menstruate? Do you have big clots? If you answer yes to any of those questions, you've got heavy menstrual bleeding.
Mm-hmm.
And people don't always realize this. They take it for granted that if you use more than a certain number of pads or tampons or so per day, that's heavy menstrual bleeding. If you only have to answer yes to one of those questions and say, oh, wait, I've got to look after my iron.
Mm-hmm.
I've taken you on a whole trip here now.
Yes.
We've just been on a safari.
Okay, so that was quite a stroll around the jungle, if you will. That was awesome. And really,
you came to Africa, right?
Yes, sir. And that was just an incredible story about that psychologist going the extra mile to not just identify, but get treatment and help to start an investigation with this woman. And I hope she's doing well now. But
She is.
so we hope that women and people in general will know symptoms, signs and symptoms of iron deficiency and get it treated before they get pregnant and while they're pregnant. And I'm a big believer in aggressively treating iron deficiency and preventing iron deficiency in pregnancy. And I deliberately use the word aggressive because we really have to be aggressive to keep up with it during pregnancy. As you said, there's an extra 1,000, of iron that we're going to be requiring during pregnancy. So what about maybe there's a woman out there listening that she's pregnant now and now she realizes, oh boy, maybe I should have done this or that, but here we are now. So what can she do at this point? And she's even, ready to go to the theater, ready to deliver. What are some things that she can think about there, or some things that providers, physicians can help intervene on her behalf there?
Sure. Yeah, absolutely. So one of the things that one can do in the third trimester, or even in the second trimester, if the patient was not responding to oral treatment, is to give a drip, a single iron drip, run in over 30 to 60 minutes, can completely resolve all the iron problems. Now, this is true for patients who are not pregnant as well. So that's the cool thing about it, is that with an iron drip, you can do a lot. But there's also something very practical that costs nothing that can be done by the person helping with the birth, whether it's the nurse or the obstetrician or whatever, whoever's involved there, is to ensure that the cord, the umbilical cord, is not clamped immediately. So after birth, before that cord is clamped and cut, there's still a lot of iron that can come from the placenta through the cord to the baby. And if you can wait and delay that clamping for 2 minutes or 3 minutes, whatever the local regulation or guidance in your country states it to be. This is actually the American Obstetrician and Gynecology Society actually formally advises this. This is that's not something I've sucked out of my thumb. They have shown in multiple studies now, compared to controls, that those children where they did the delayed clamping have better cognitive development 4 years down the line.
Wow.
So it actually helps their brain development if you just do that simple act, which costs you nothing, just patience.
Just allow that.
2-3 minutes of waiting. Just calm down. Yes, it's exciting. The baby's out. Yes, the baby needs to go to the mother and be on her breast and chest, and everybody is, smiling and laughing and all the rest. Just breathe. Take that time to give the baby the best chance long term.
Fascinating. And as we wrap up the discussions, we've really hit on a lot of topics. What would you say to anyone that's listening today that maybe we've hit a subject, heavy menstrual bleeding, or anxiety, depression, or cognitive, functions? If they're concerned about their iron deficiency, what would you like for the audience to know and to take away?
Okay, so this morning on my ward round, I found a patient there in the ward who was actually anemic already. So I said, where are the iron studies? Oh, no, they'd not done it. I've got a rule. If the patient has a pulse, a palpable pulse, then you have to do the iron studies. Okay? So, where I live, Cape Town Harbour is there behind that window behind me. Here in Cape Town, 56% of women who are apparently healthy have iron deficiency.
Wow.
More than 1 in 2.
Wow.
So I'm saying, what are you waiting for? Don't wait until you don't have a pulse. If you have a pulse, go and check your iron levels. If you're a woman, 1 in 10 men have iron deficiency who seem healthy. That's not here in Cape Town. 1 in 2, more than 1 in 2 women have iron deficiency. If you throw a dice and it's going to be your odds of winning a prize or something bad is 1 in 2, 1 in 3 or 1 in 5, that's a serious odds. So I say, if you're a woman, have your iron checked. If it's low, get it treated, and it has to be monitored, and you must ensure that you do reach your targets. And we've got targets for treatment as well to make sure that you've got enough iron. And I like the iron to be treated to the point where it's adequate for a next pregnancy. And for those people who have heard about ferritin as a test, maybe some people have heard that name. I want that ferritin above 100.
Yes.
If that ferritin is above 100, it's typically enough for a pregnancy. Then you're cool. If it's below 100, I don't like it.
Very good. I'm going to ask you a second takeaway. What would you say to the medical professionals who are listening to the podcast? What do you want them to take away from this discussion?
I think I want them to realize that this is a problem where they can be of help to almost every family that they see. This is the one simple thing where you can revolutionize the quality of life. Why do I use the word revolutionize? On Wednesday evening, we had a group of friends at our house. And during the conversation, one of the friends who had asked me to look at an iron test some while back, and she was very iron deficient. So I gave her some advice to go to a doctor and get it treated, and etc. And so she was treated. She spontaneously, we were just sort of sharing around how everyone was doing. She said, I did not realize in what a bad condition I was, because she was not anemic. She was not anemic. She was just iron deficient. She's also a runner. And she says, I've got so much energy. And she used the words revolutionized. She says, my life has been revolutionized by just getting iron on board. This is a woman who's got all the food in the world. They're well off. There's no issues. But like any other woman, she's at risk. She got it. And it's a month or two later, and she's a changed person. So I'm saying to doctors, make happy patients by screening them for iron. Screen your women patients once a year. I say to mothers, you want to make happy babies, get screened for iron deficiency. If your doctor doesn't want to screen you, I've seen that too, find another doctor that is willing to screen you. Do not accept that it's not necessary. I see that all the time. The doctor will say, no, but there's iron in this supplement. No.
Wow.
You want it properly. You don't want the 50% level of care. You want the platinum gold level of care. The bronze level is take your supplement, you're going to be fine. Platinum gold, this is why you need it. This is how we're going to screen you. This is how we're going to treat you. This is how we're going to monitor. We're going to make sure you are good, you are safe, and baby is good. So go for platinum and gold. If you don't get platinum and gold, go somewhere else.
Thank you so much for your passion and your drive to educate on this subject. We are going to link your YouTube channel, and I'm hoping I get to meet you personally in Munich.
I'm looking forward to it,
so
Sarah.
April 24th through 26th.
I've met Mary Ann already,
in Munich,
but I'm looking forward to seeing you as well.
We want to meet in person.
Yes,
okay?
That's going to be lovely. Listen, thanks for the opportunity. I'm always so excited to share this message because I think it's a message that's easy to respond to. And I think everyone, just tell one other person about this. You can make a difference in someone's life. Just tell somebody else. You don't have to be a doctor to make a difference. You can tell one other friend, one other family member. It's going to make a difference.
Absolutely.
We hope you enjoyed this conversation and found some takeaway or new thought that improves your health. We would love to hear from you. Feel free to reach out to us on our website if you'd like to see what we're up to. Our website is letstalkpbm.com. If you enjoy our conversations, please like and subscribe wherever you listen to podcasts and on our YouTube channel.
Special thanks to our guest and our producer Delaney Coronado and the entire production team for all of their expertise in content creation, technical abilities, and dedication to our message. We appreciate the experts who drive this medical movement forward and our affiliate partnerships who support the work that we are doing. Until next time, stay connected to your blood health.